I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and MediSpa. Welcome to Ask Anonymous, where it's our monthly segment where patients get to write in questions for me to answer. And once again, we have some really good questions this month. So Ella's going to kick off the questions and I'll give you what my thoughts are.
When should one consider liposuction versus GLP-1 treatments?
So that's a good question because GLP-1s have become so common and household names now. So realistically, you have to remember GLP-1s are a weight loss medication. Liposuction is a contouring procedure, so they're different. So what I would say is that when patients come to me about liposuction, if they're within 10 or 15 pounds of their goal weight, then we can start talking about how we're going to now contour whatever part of their body they want to have improvement. So if you are using GLP-1s or diet and exercise or gastric sleeve, anything to help get that weight under control, then I would wait for the liposuction until you get within that goal range, and then we can talk about it. But really think about liposuction as attacking those areas of your body with weight loss or diet and exercise that really haven't contoured the way you want them to contour. And I hopefully that answers it.
After undergoing liposuction on the arms and legs, is additional surgery necessary to remove excess skin, and does this result in large scars similar to those from a tummy tuck?
Another good question. So not always when you have liposuction in any area of the body would you need to have excision of excess skin. Now, it really just depends on what the skin quality and the tissue tone is like. And that's why for me, I like to see patients in the office when we talk about body contouring, because I really want to have a good assessment of where their tissue and skin, their tone is. So a lot of times we talk about liposuction maybe to set up for an arm lift or what we call a brachioplasty or a thigh lift. Sometimes I combine them together and you can do liposuction and an arm lift together. But there are many times you can do debulking or just contouring of an arm or thighs, and the skin and tissue tone is good, that it will allow for redraping of those tissues without the need for excising them.
I had a facelift 7 years ago and am now experiencing sagging and marionette lines around my mouth. What are my options if I prefer not to have another facelift?
So if you're starting to have some of the return of the soft tissue kind of descending forward in the jowling, maybe a little neck laxity, you can actually undergo just sort of a touch-up facelift, so not a full-blown facelift. So sometimes we can use part of the incision that was from the facelift from before, go back in and just tighten those areas. So you can have a surgical procedure, it may not be a full facelift. There are other options that you can have. Sometimes a little bit of dermal fillers in certain areas can help lift that tissue back into position. We also have had good success with using our Virtue device in this office, and that is the combination of microneedling and radiofrequency. And we use a D-pan piece, which is 36 needles that are used after we apply topical numbing to the skin. And that can go into areas, treat some heaviness or a little bit of fatty tissue that's been building up, and also tighten the skin with that. So there are options now that you may not have to go back in and have a redo or secondary facelift procedure.
I have 18-year-old saline implants and a previous bilateral masttopexy. I'm considering implant removal. Would insurance cover this? Can an arm lift for loose skin be combined with this procedure?
So 18-year-old saline implants, that's usually pretty good because they usually last about 15 to 18 years and then they will rupture. So at some point you're probably going to want to have them replaced or removed. It's hard to know if you just remove them how much tissue you're going to have left. So again, that's why the consultation is so important, that the surgeon can kind of feel how much breast tissue you have versus the amount of, how much of your volume is from the implant itself. So we can kind of give you an idea. So definitely have a conversation with the plastic surgeon about that. And yes, whether you remove them or remove and replace them, you can do an arm lift surgery at the same time. And to go back to your first question as well, insurance companies will not pay to have intact implants removed. Once in a while, depending upon your insurance company, they will pay to have them removed if they're ruptured.
How can one gain practical experience in administering injections and fillers while in graduate school for nurse practitioner with a focus on aesthetics, dermatology, and plastics?
That's a good question. There are probably, through some of the companies like Allergan and Revance, Galderma, some of the big companies that we use, sometimes they have workshops and courses that you can take. So I would recommend maybe looking into those places and see what they have to offer.
What is the best treatment for chin shadowing?
I always laugh at the new nicknames they give for everything. So the chin shadowing is sort of the newest thing and that people want to talk about. But basically, classically, we use dermal fillers around the chin to give it better either projection of the chin or fill in those little concavities that are on the side of the chin. So dermal fillers are still very good there. Fat grafting can also work. The other thing that you might want to look into is sometimes you have some chin shadowing or the chin doesn't look as prominent because you have some excess skin or some fat right behind the chin in this area called the submental area. So we have also been using our lipo AI device, which is laser lipo, and do a lot of liposuction in the submental area to increase the lower border of the jawline and give that a little bit more contour there. Also, it can hide or remove some of the fat behind the chin and give that chin a look that has more projection to it.
Is it possible to perform upper blepharoplasty procedure while the patient is awake?
Yeah, that is. I have colleagues that do it that way. I prefer not to. I like to do it under IV sedation. So I usually do that in a surgery center and have the anesthesiologist and the nurse anesthetist give you a little bit of medication so that you're just sort of in twilight, you're breathing on your own. I just think it's more comfortable for the patient. And when I'm doing that, it's a delicate surgery and I like the patient to be completely immobile, so you're not moving or blinking or anything like that. I think some patients can do it under local anesthesia. I know for me, I would do better under IV sedation.
How soon after a pregnancy is it safe to consider a mommy makeover, and what procedures does that typically include?
That's a good question and a very common one. So what I usually recommend for ladies is once you're done having children, to wait. It usually takes about 6 months for your breasts and the belly and everything kind of to go back to what is normal, its normal tissue tone. If you're breastfeeding, then it sometimes takes 4 to 6 months after you're done breastfeeding for the milk to dry up completely. We really do not like to have any milk production while we're doing any type of breast surgery. So I would tell you, once you get back down to that normal body weight and your body, and most women can tell when their body has returned to normal. For most women, it's about 6 months. Now again, the procedures associated with a mommy makeover depend on what the lady needs. So some women just need an augmentation and maybe liposuction, or an augmentation and a tummy tuck. So the breast can be anything from augmentation breast lift, could be a breast reduction. The abdomen is usually a tummy tuck or liposuction, or a tummy tuck with liposuction of the hip area. So it just really depends on what that patient might need.
How effective are laser treatments in removing acne scars, and how many sessions are typically required?
So we use a combination of our Helix laser, which is a laser that combines CO2 and a 1570 nanometer laser. So that will give you resurfacing and skin contracture. When we combine that with our Virtue device, and that again is microneedling with radio frequency, and we've had excellent results with that combination. So we usually do 3 or 4 of the Virtue, and then in that, usually somewhere in that scheme, we'll add a Helix laser to it. So you usually do just one of those. And again, it depends on the depth of your scars. Some patients have very mild acne scars, and you may only need 2 Virtue and a Helix treatment. But some patients will have what's called ice pick acne scars, which are very deep. And so those are really hard to treat. So you might need 4 or 5 treatments with the Virtue and one of the treatments with the Helix. But we've had really good success. It's one of the probably some of the happiest patients in our spa area that really treating this. And we also treat, some patients have it on their upper shoulders, on the back of their shoulders, and we've had great success with that as well. So it's a combination to attack those scars.
Can you explain the benefits and risks associated with fat transfer breast augmentation compared to traditional implants?
So let me give you my opinion, and some of my colleagues may disagree with me. I like to do fat grafting, and I use it in many areas of the body. However, when it comes to breasts, especially with breast augmentation, I'm not a big proponent of it for a number of reasons. Number one, implants are safe, especially silicone implants. They're safe devices. They give you good volume. You can try different shapes. So there's different, we can choose what's best for you. It's a one-time surgery. So sometimes we can do fat grafting to help with that, maybe, you know, improve the cleavage area, give you a little bit more upper pole fullness. But my option is to usually go with an implant. Now, the reason I don't like the fat grafting is, number one, a lot of younger ladies that want to do that don't have enough donor site to do a good fat grafting. And fat grafting is we all think about, or patients come in thinking that you just kind of load up a syringe and just push it into the tissue and just like putting in an implant. You're transferring living tissue from one area to another, and that living tissue has a blood supply. So when you take it away from its blood supply, it has to reestablish a blood supply in the new area. So if we take it from your hips and your abdomen and we put it in your breast, it has to reestablish. So you can't put in large volumes. You have to put it in very thin layers of fat. And the analogy I usually use is, think of how a farmer puts seeds into the ground. He just pile them into the ground. He has to lay them out with enough distance that the blood supply can get into those individual small clusters of fat. If you put in too much, the outer part will get blood supply, but the inner part won't. And that will usually either calcify or it will turn to liquid, and sometimes you can get a cyst, an oil cyst. They can be painful, it can get infected. So, and then if you start getting calcifications, then I worry about that for future mammograms, that is going to show up on a mammogram, and it might confuse a radiologist that it might be an early tumor. So fat grafting, no matter where you put it in the body, usually takes at least 1 and sometimes 2 and 3 procedures to get to your final outcome. So it makes the cost of a breast augmentation with fat much higher. The risk is asymmetry, because the fat may take better or get more blood supply on one side than the other. So now you have some asymmetry that you can correct with implants. If you were just going the implant way, you may have to go back and, put more fat or fat graft more on one side. So you kind of chase your tail a little bit. So for the cost of it, for the downtime, and realistically, even with good fat grafting, going up 1 cup size is hard, but 2 and 3 cup sizes is very difficult. So you really do have to have the donor site as well. And that's the conversation I have with patients when they come in. So, I feel that there are parts of the body that have better fat to transfer. Sometimes the abdomen and the hips are the best, the inner thighs a little bit, but then you have to worry about, again, when you start taking fat from these areas, are you going to leave contour deformities in those areas as well? There are colleagues that will take it from the arms, the back, the outer part of the thigh. They're more fibrous and they don't transfer as well either. So I think it's a harder surgery to do when you use those areas. Plus, you have a higher risk of contour deformities in the donor sites when you start taking them from the back and the arms and areas like that. So that's just my opinion on it. So thank you so much for sending in those questions. They were excellent, and we'll do this again next month, so we'll be looking forward to some more questions. If you want any question that you want, I'm happy to try to answer for you, and we'll see you next time.